Good afternoon to one and all. Respected speaker sir, all the faculty members joined today on this 16th Agada-Sambhasha. It is a matter of immense pleasure and pride for me to introduce today's esteemed expert speaker, Professor Dr. Mahesh Savalagimath sir. Dr. Mahesh Savalagimath sir is a renowned academician and distinguished scholar in the field of Agada Tantra. Sir has completed his BMS from KLE's BM Kankanwadi Ayurveda College, Belagavi, and MD in Agada Tantra from the prestigious Vedratnam PS Warrior Ayurveda College, Kottakkal, Kerala. Presently, Sir is serving as a professor in Department of Agada Tantra at Sri BM Kankanwadi Ayurveda Mahavidyalaya, Belagavi, Karnataka. With over 17 years of undergraduate teaching experience and nearly 16 years of postgraduate teaching experience, Sir has played a pivotal role in shaping the careers of numerous Ayurveda scholars. As a postgraduate guide, he has successfully mentored 18 MD scholars, and his scholarly contribution include 43 research publications and more than 155 invited lectures and expert talks. On a personal note, I consider myself fortunate to have his postgraduate student. His dedication to teaching, clinical excellence, and unwavering commitment to the advancement of Agada Tantra have been constant source of inspiration for me and many others. Today, Sir will enlighten us on the highly relevant topic Agada Prayoga in skin diseases. I am confident that his vast experience and profound knowledge will greatly enrich our understanding of this subject. With great respect and admiration, I warmly welcome Professor Dr. Mahesh Savalagimath sir and request him to kindly deliver his expert lecture. Thank you. Over to you, sir. Sir, you are not audible, sir. Not audible, sir. No, no, sir. Not audible.
Am I audible?
Yeah, yes, sir. Yes, sir. Now you are audible.
Okay, let me share.
Welcome, sir.
Thank you. Hmm, Where is my PPT?
I have done the introductory part, sir.
Yes, yes, I was listening to you. Uh, whether my slide is visible?
No, sir.
Okay.
Screen is visible, but slide is not visible.
Um, share. No. Now,
Yes, sir. Yes, sir. It is visible now.
is it moving?
Sir, move it once, sir. I will tell you. Yes, sir. Moving, sir.
Moving?
Yes.
Okay. How to minimize this? Okay. Namaste, everyone. Thank you, Dr. Ashish, for that introduction, and thank you so much for giving me an opportunity to be part of Vishwa Aerial Pursuit lecture series. Hope I am audible. Just once want to confirm.
Yes,
Ashish,
sir.
am I
Yes,
audible?
sir. Audible,
Okay.
sir. Audible, sir.
Okay. So first of all, I would like to give my salutations to my teachers, because of whom, whatever I am today, if I am practicing Ayurveda dermatology, based on Agada principles, all the credit should go to these teachers because of whom I got that knowledge. And if at the end of this lecture, if you feel you got anything, then all the credit should go to them. Now, first of all, what is Visha? When we look into Visha, what it is actually? Visha is not a disease, right? Visha not a disease actually. Visha is Hetu, right? Visha is Hetu, etiology. Now, what is Agatantra? Agatantra is the Ayurveda which deals with Visha Chikitsa. Means what? Visha Chikitsa means, is it treating Visha? Means Visha as a disease it is treating or something else. Agatantra is actually considering among Ashtangas, it is Hetu Chikitsa. We are treating the Hetu. Visha is Hetu, right? So I'll be trying to focus more on that way, how we are going to approach or how we have to approach skin diseases from Agatantra perspective, right? Because Hetu plays very important role because our branch deals with Hetu Chikitsa only, Visha Chikitsa, right? So today, my topic is like application of Agada principles in clinical dermatology. And whatever I'm going to discuss in 1 hour, next 1 hour, is just refresh your knowledge. You all know all the things that I'm going to share. It's not like something I'm going to something new I'm going to give, but here and there, little bit, some new ideas you may get. But uh, everyone knows everything. All are excellent in their areas. Kind of refreshment. Now, most important thing why we need to relook into this is the healthcare needs are changing, right? Healthcare needs are changing. When healthcare needs are changing, there should be change in adaptation. We need to change our approach everything, right? Now you might have seen like how the IT sector has affected by AI. Now how people are very quickly they are trying to learn AI, artificial intelligence, and then machine learning and all. Now why it is happening? Because only those who are able to make that change, adapt to that change, they are surviving. Those who are trying to resist it, they cannot grow in present era. So I always give example of this movie. There is a movie for those movie lovers. It's a completely action movie, Undisputed 3. In that, there is one principle. It is called as adapt, overcome, and improvise. So I just altered that order: adapt, improvise, and overcome. So what we need to do is we need to adapt our knowledge, improvise our approach, and then practice. And only we can overcome the challenges because healthcare needs are changing. So when needs are changing at that time, keeping our basics intact, adapting our basics intact as it is, we have to improvise our approach because healthcare needs are changing. If we are going to improvise. If we are able to improvise in our approach, then 100% in practice, we are going to get good outcomes, right? So most of the times I have interacted with many other people. It's not like I'm not not telling anything is wrong in this, but it is individual perception. But in my view, most often we are focused on other people are focused on like we management of poisoning, snake bite management, forensic aspects, autopsy and all. Now here what I want to say is we need to be very practical. We need to think in practical way, right? We need to understand the scope. Simple example, when I was doing post graduation, I had the opportunity, I was asked to go for 3 months posting or 2 months posting at Papincheri Vishwachikitsa Kendra, where snake bite management will be taught. Now, I just said that I cannot go there. That I cannot spend that much time because even if I become expert in snake bite management, where I have decided to settle in that area, the incidence of snake bite itself is less. Even if it is less, the number of patients that are going to Ayurvedic doctor is almost nil. So when there is no scope for that, why should I learn? Why should I invest my time, money, everything in that, right? So that is why I decided I will be there, going there for a week or so that I will learn it to teach undergraduates. That's enough. I know it for that, but not to practice. But I continued my entire, focus on dermatology because I knew there is a scope for that. So we need to understand whether we want to have request our management to give us set up for poisoning management. Do we have scope for that? We need to think on that. I'm not discouraging anybody. I'm not discouraging anything. We need to focus on some things like whether we have scope. Next, is it feasible for where we are working as a part of an institute or independently also even if we are working, is it feasible? And do we have the support for all the aspects, legal, medical, legal, maybe in the conditions where there are some complications or very fatal conditions are developed, or something goes wrong with our treatment. Do we have any support system for that? Do we have that what you can call legal support from the institute and all these things we have to evaluate. Then we should think about what we need to develop, what we need to practice, what we need to grow in, right? Otherwise what will happen, it will be like fighting in the air. So at the end of the day, nothing will be achieved, nothing will be accomplished. So instead of that, we need to focus on our own, the scope of the area, our support system, feasibility, our strengths. Based on that, we need to work and we need to develop, because we all are capable. We all are capable. Everyone is enabled with each and every knowledge. But the problem is that every knowledge is not applicable or not is not having scope in each and every area, right? So as per the location, as per the institution we are working, as per the need of the area, we need to use that capacity, right? So that is why we need to adapt to the current trends, current requirements, current needs. Adapting is always difficult, right? When things change, very simple things. Even like, we are simple, like every day we are taking metro and one day we miss the metro and we have to go by city bus. Then adapting to city bus, or entire route is cancelled for a week, or it is completely the metro is stopped, closed. We have to take city bus or something like that. So that irritates us. So adapting to simple thing I'm telling. So when things change, adapting takes time, right? Adapting takes time, but there is no option, right? There is no option. Whether we want to adapt for the sake of regulations, or for the sake of personal growth, choice is ours. But ultimately, we have to adapt to the changes that are occurring in the healthcare sector, right? So for that purpose, we need to be thinking, approaching Agatantra based on our own perspective, considering the scope, feasibility, and the support system, along with our own capacity, right? Based on that, we need to approach in the like implementation or practice of Agatantra, right? So as I was telling, we are discussing about skin disease. So Vishay Chikitsa is Hetu Chikitsa. Vishay is Hetu. Now Vishay Chikitsa, Hetu Chikitsa, and it is the first pillar of Sri Sutra Ayurveda, right? Hetu Linga Ushara Dhyana, right? So that is why I always feel something which is not practiced or not given so much of importance among three sutras, only Agatantra department or Agatantra subject is giving more importance to that, right? Be it practice of any other branch, right? There, it is not given that much importance, being it is one of the most important pillar of Ayurvedic Chikitsa, right? Three Sutra principle. Whether we practice in any way, Ling and Aushadhana, we will be having. So additional thing that we are having, being Agatantra people, is the Hetu Dhyan and giving importance to Hetu. So that is why we should feel little comparatively prouder than other sectors. I'm not telling that everyone neglects Hetu, but most often in clinical practice, Hetu is something which is mostly neglected, right? When we look into the etiology of every disease, each and every disease, not only skin, every disease, mostly 90% of our diseases have ahara as a hetu, right? Food is the main hetu for each and every disease. Next comes the vihara and vichara, psychological aspects also, right? Now, this ahara, like for example, I always tell, like it's not about how it looks or how what we're eating. Simple example, whether I have added, no, I have not added that. Huh? In Sutrasthana, while Acharya Charaka, first chapter only, while explaining that Madhura, Amla, Lavana, they do Vata Shamana and other, like while explaining, there Chakrapani, he only asked one question, that Madhura, Amla, Lavana, whereas Vata is not having any rasa and it is Amurta. How these rasas are going to, do Vata Shamana? So then he only answers, it is not Madhura, Amla, Lavana, the rasas, it is the gunas that come with that Madhura Dravya or Amla Dravya. But he said, Snigdha, Guru, those gunas are going to make the changes, do the Vatashana. Similarly, the things that look similarly as they were previously, same as they were previously, but they are not the same internally. I usually give the example of the capsicum, the big capsicum, no, which is used in the what is the pizza and all. Even we can eat that capsicum without anything, like we do not feel katurasa, but still we get hyperacidity. Means the dravya, rasa, what rasa it is coming, how it is looking is not important. What it is bringing along with that is important. Like for example, kalaya is said to be vatavardhaka, right? Uh, exactly, kalaya, green peas can be considered as kalaya. Now, what this kalaya comes with, दिखने के लिए वही कलाई है, right? Taste भी वही है, लेकिन what it comes with, right? It comes with fertilizers, pesticides, additives, and causes vata prakopa. Now, is it right to call that vata prakopa, like kalayajanya vata prakopa, as just vata prakopa caused by kalaya, or vata prakopa with savisha kalaya? That is where we need to think. When it comes to kushta, skin diseases, milk and non-nutrient food combination is said to be one of the best, or what you can call the most important cause of skin disease, right? Now, in this, if a person consumes this and gets the kushta or skin disease, calling that as Viruddhaharaja skin disease is okay. It's okay. But in present day, the aquatic food, aquatic food comes with heavy metals. There are so many studies. The other meat comes with medicines, growth hormones, and even fertilizers, pesticides, because for growing, cultivating that grass and all, cattle, so much chemicals are added, and the milk and milk products come with adulterants. Now, by this consumption, a person develops kushta or skin disease. Now, is it wise to call it as a skin disease caused by regular Viruddhahara? No. Right? We have to call it as Savishavrudha. Right? Savishavrudha. This is what I was telling about the changes are occurring in the healthcare sector. Now, banana and milk and fruit is said to be the bananas. More than 90% of fruits in India are, banana and all are mangoes. They all are ripe using calcium carbonate. Right? If you remember the shloka from Ashtanga Sutra 7, Phalanam Amanam Pakaha Pakwanam Parikotanam. What it is said, when Amaphala come in contact with the Visha, they get Pakwa. If that contact remains intact for some more time, Pakwanam Parikotanam, they get decayed. The same thing is happening. The green bananas are dipped into calcium carbonate solution, or they are dusted. Within few hours, they become right. And the bananas which used to be, stay healthy, intact for months or 15 days, now they get decayed within a week, less than a week, because Amanam Pakaha Pakwanam Pariputnam. So, Savisha and milk is coming with allergens. Now, if this is causing a skin disease or any disease, calling that as simple, regular, normal Viruddhaharaja Vikara, then it is not right. Okay? This is only the thing that we need to adapt. We need to, adapt basics. So what we are trying to, we are considering the Viruddhaharas. We are not ruling out there are no Viruddhaharas. There are Viruddhaharas. Now, what we are doing, we are changing our approach because we are trying to improvise our understanding by considering what this Viruddhahara is coming in present day. It's coming with Savisha. So we need to consider it as Savisha Viruddha. Okay? Then, if something is coming or caused due to Visha, what will be the treatment? Acharya Charaka, Sanghradaya, everywhere. Every Samhitas, every Acharya have, in different contexts they are said. Like, for example, in, I think this is Shota, where if the Shota is caused due to Visha, what Acharya says? Vishagnam, Vishaje, Sakarma. Means in Vishaja Shota, we need to do Vishagna Karma only. Even in Ashtanga also it is said, if the Shota is caused due to Visha, then Vishagna Chikitsa only you have to do. In Jwara Adhikara also Acharya Charaka says, so much explanation is given for Shota. So much explanation is given for Jwara. And last, when it comes to Jwara, caused due to Visha, Acharya says, Vishajit Jayet. You can win or you can cure Vishajit Jwara by Vishagna Chikitsa only. Means at that time also, Acharyas were teaching or asking their disciples to treat based on etiology. The only thing at that time, the incidence of Visha exposure was very, very less because it was mostly what you can call homicidal. Anya Pani, Dantakasta, you can see that is Garaj and that type. Gara means like homicidal type of artificial, okay? But there is Kadapradawala to cause the disease. adding poison and all, means homicidal was the most. But present day, it is what you can call, even we cannot call it as accidental. It has become like incidental, part and parcel. Each and every aspect we get exposed to Visha. Now imagine if same disease if is causing due to such Visha exposure, if Charakacharya was there in present era or Vagbhatacharya was there in present era, then whatever is explained for normal disease, normal Shota, that much explanation Acharyas would have explained for Vishesha Shota, and for Nirvisha Shota, he would have explained something else like without Vishagna you treat. Because the things have changed. This is what is the change in healthcare industry, right? The etiology is completely changed. Then the line of treatment should also change. Treatment approach should also change. Its change means not completely changing everything. Slight change, I will tell you. So the treatment approach for current diseases, they are the same conventional diseases, right? They are the same conventional diseases. Only difference is etiology. Only difference is etiology. I always ask when we read any Vishay related chapter, including each and every Lakshana or even the diseases that are explained in Garavisha, Dushivisha and all, they are not new. They are not new. They all are the same, which are explained either in Nidhanasthana, Chikitsasthana, or Uttar Tantra, other chapters. Right? They are the same diseases, same symptoms, same signs and symptoms. Only thing is, etiology is different. So there is no difference at all. Everything is same, but the etiology is same. Etiology is different. So that is why we need to change our approach. In Chaturvimshati Upakrama, we get three important things. Sometimes people get confused. Prativisha, Prashamana, and Aushadha. Prativisha, we all know what it is. Vishe, Visham, Teya. Administration of Visha in Visha condition is Prativisha. Now, we leave that. Savisha, Agadas and all will come in that. Okay, snake bite management or in such condition. Now, remaining two are very important. What it is? Prashamana and Aushadha. What is Prashamana? Prashamana is Karya Chikitsa, Karya outcome. So when Visha enters in the body, what it does changes in the dosha and that brings clinical presentation. So whatever we are going to use for the dosha or the Karya, that is Prashamana. And whatever we are going to use for the Visha or the Hetu, which are set in this, those changes in the dosha, that is Aushadha. If we read the meanings or definitions of Aushadha, then it is as chitta, pakshataapa, something like that. It is a meaning. Means correcting the cause, treating the cause, right? Prashamana is dosha or like daha is there, daha prashamana, shota is there, shotahara, like that. Now, Aushadha we get from Agadatan, right? We get from Agadatan. From where we get prashamana? From where we are going to learn, like from where we use Shotahara, from where we use Kanduhara, from where we use like Joragna, from where we use Mutrala, from where we use them. We are using them from Kai Chikitsa only, right? Kai Chikitsa only. So Prashamana from Kai Chikitsa, Aushadha from. So my approach in clinical practice is blended approach, blending of Agatantra with Kai Chikitsa. Whatever Vishagnas we are select, be it Shirisha, Rishta, Shirisha, or any of the Dashamanis, or any of the Agadas, we take them from the principles of Agatantra. And whatever Shamana Uchadis we are going to use, they all are from Kayachikitsa, which we all know, right? Both we all know, right? We have studied the Agadas and we have studied most of the formulations. And many of us use them, right? So the approach will be blending of Agatantra with Kayachikitsa. Same is done even in Samhitas also, right? In Agatantra also, Vishachikitsa Adhyayas also, they have used blending because Kayachikitsa is considered as base for entire Ayurveda, right? Base for entire Ayurveda is Kayachikitsa, right? So blending Agatantra with Kayachikitsa should be the approach. So what are the basic requirements for successful and effective practice of Ayurveda is based on Agatantra is assessment of condition, dosha assessment and selection of suitable Aushadha and Shaman, right? I usually practice based on this principle. Like I select medicines for Karana based on Agada, for Karya based on Kayachikitsa. Sometimes the Karana leads to one Karya, which will not be a disease, that can be considered as internal cause, Karana, and that leads to another Karya. So at that time, I select medicine for this, for this, for this. Like for example, Dushivisha led to autoimmunity. Autoimmunity is not a disease. Autoimmunity is a pathological entity which can cause many diseases. So I'll be selecting medicine for Dushivisha, for autoimmunity, and for the outcome, the disease, whatever autoimmune disorder it has caused. Right? Okay. So importance of dosha assessment. Dosha assessment plays very important role because selection of proper shamana, aushadhi, is based 100% on dosha assessment. Because maybe because of non-availability of most of the agadas, we don't have much, we don't have to do much, effort in selecting agadas, right? We have Dushi, Shari, Bilwadi, Dashanga, Murwadi, uh, Panchashiri Agada we can prepare. Very few agadas are available, right? So there is no much options. So no need of much, struggle or much, pressure in selecting Aushada. But for Prashamana, to get better outcomes, to select Prashamana, we need to be good in dosha assessment, right? We need to be good in dosha assessment. Now, how to identify Hetu? I told Hetu Chikitsa, right? Basically, we are going to use Anumana, right? There are multiple classifications of Anumana. There are two classification, one classification where it is a Karyat Karnanumana, Karana Karanam, right? By seeing Karana, we assess the condition and say this is because of this, or we see Karya, seeing the presentation, pattern of presentation, and by that present pattern, we say that this is caused because of this, right? That is right. So we will see like that. So first we will see Karanat Karanam, right? Etiology is known. Etiology is known, so outcome will be easy to understand, right? So we'll see three cases: acute, subacute, and chronic, all the three sectors. 58-year female with diabetes, non-controlled diabetes, came with the complaint of vesicles, vesiculobular presentation on right forearm, wrist, and all with swelling, right? Vesiculobular lesion, severe burning, mild swelling, low, right? Now, this was the presentation. History is very important, right? History taking is very important to understand, to rule out cost, to know the cost. Patient presents with history of accident. She fell in the house that resulted into sprain in her right wrist before 1 week. As part of that, she went to treatment for that. To take the treatment, she went to I think modern surgeon. I think they took, and they prescribed one gel, antidote gel. After applying the gel, patient took mild sting. The problem is patient was not educated. So she applied it and then cooker say steam daily, right? Because of this gel and then followed by little massage also she did and followed by steam, she developed burning sensation same day and appearance of boils over dorsum of right hand. And the very next day, it was associated with feeling of heat, warmth, burning sensation, and was in severe nature. So diabetic, hypertensive, blood sugar was not in control. It was irregular. There is no family history, right? So this was the one which was prescribed, right? So when we consider the Lakshanas, they were having the Lakshanas of Abhyanga, right? Spotajanma, Ruja, Srava, Tokpaka, Swedanam, Jalaha, Abhyanga, Shatanati. Lepa, Abhyanga, right? So I gel C applied, so I consider that Lepa or Abhyanga. So Abhyanga or Lepa Visha, contact poisoning. Pitta Pradhana, Kapha. Pitta Pradhana, Kapha. So what I gave? I gave her internally Patola Katorinadi Kasha, Pitta Kaphara, Virichaka, Vishagna. Bilwadi Agada, Vishagna. Externally, Pitta Kapha dominant, so Panchavalkala Seka, Narcom Red Tail for external application. This was given on 11-1. Now, patient came on, I think 14-1. You can see 3 days, the lesions have reduced in severity, but slight swelling has increased. Burning and all reduced, right? Vesiculobular persisted, burning sensation reduced, swelling increased, local temperature reduced, right? So, what I did, right? Vishagna, Aushada, Prashamana. So where we have to do the changes in the follow, we have to make the changes in the Prashamana only because कार्य में changes आ रहे हैं ना कारण तो वही था पहले. So I continued it same, but added Punarnavadi Kashaya after food. 15 ml thrice daily after food. Right? 14-1. This is on 19-1 after 5 more days. Whatever you are seeing here, these all are the dead skins of those bullet. Right? This is on 27, I think. 27-1. No more follow-ups, only single prescription and in between one visit where I gave an extra additional Punarnavadi Kashaya. Right? 11-1 and 27-1. This is the outcome. So how it was possible? Because we selected the medicines for Karana and Karya, right? Okay, this is a subacute case. We can call a type of intermittent ones. This was diagnosed by modern India. I have not diagnosed it. First time I came to know this disease when patient came to me. I'm very poor in modern dermatology. So she had this type of scaly lesions itching all over the body, which usually occur mostly in cold, uh, rainy season. If she take any modern medicine, like for example, she's having fever, if she takes paracetamol or any NSAIDs, Sinarest and all, by eating ice cream, by playing in Holi, right? Like that. This was from, I think, the age of 8 or 9. At the age of 8 or 9, patient was given penicillin injection. Same day, he developed rashes all over the body and was given antihistamines and complaints were produced for time being, right? But the rashes kept on recurring very frequently and gradually developed scaly lesions. And she was diagnosed with eczema, enlarus, and fever. Again, an autoimmune or allergic type of manifestation. Then she kept on taking modern treatment, which was giving just symptomatic relief. And when she consulted us, at that time she was 21-year old. Almost she tried the same medicine for 10 years, right? Now you can see the pain, right? So I told her it's best you should go for Virection. But she was not ready to take ghee, the Grita, because घर का घी नहीं खाती थी. So she was reluctant to take Grita. So we thought like we'll go with Nitya Virechana type. So first 15 days, I gave her a Patola Muladi Kashaya, 10 ml. She was little bit lean. Sorry, spelling mistakes will be there. Please ignore. It is ml. 10 ml twice daily on empty stomach with warm water and Dushi Visharivika 2 tablets twice daily after food with honey. Right? First 15 days. So during that, she used to have 4, 5 times loose motion. Some days she has taken only one time like that. Kashaya one time, tablets 3 times like that. Kashaya was not consistent, but Dushi Vishari were consistently taken. Next 10 days, treatment was Patalamuladi 10 ml twice daily and empty stomach, Dushi Vishari thrice day with honey. And same was continued with the 10 days gap. 10 days she has to take, then 10 days gap, and then again she has to take. This was done for 3 months. We did it for 3 months, right? And then this was the outcome. The main thing is here, not before and afterwards, right? The main thing is it's been so many years. She has never developed again this. It's been 9 years or more. She's perfectly all right. She plays with Holi, she plays Holi, she can walk in rain, she can take like bukar वगैरह आ गया, she can take paracetamol and all, no issues at all. Right? That is what what we can consider like we are treating Hetu, right? This is what you can call a little bit chronic. Pedicles, 56-year-old male, pedicles with circular base all over the body, including oral cavity, anus, penis, associated with pus formation, itching, erythema, side scaling, and burning sensation. Pain all over the body, more at joints since 3 years, right? Edema at both extremes. On admission, severe burning sensation and erythema and pain all over the body, and at mostly at the joints was seen. Now, history is 3 years back, patient was said to be apparently healthy. One day, he developed a few pilicas on the face. acne या cyst जैसे हो गए. And he was what you can call practicing doctor. आरएमपी वगैरह गांव में प्रैक्टिस करते रहता ना जो नॉन क्वालिफाइड रहता है वैसा है. So वो खुद मेडिसिन दिया और कुछ एक्स्ट्रा एप्लीकेशन करा. So on third day, condition worsened. Stopped that medicine, and by fifth day, pedicles spread all over the body with severe burning sensation. And then he went to modern doctors and all. He took modern treatment. Along with habit of 25 to 30 cigarettes per day since 28 years and self-medication, frequent self-medication. and almost 6 days or 5 to 6 days non-veg for a week, right? And this patient went to Morgan Hospital and they diagnosed it as erythema multiforme, a type of, again, very severe condition, right? Like Steven Johnson's and all, whose category में आता है. But Steven Johnson's is more severe. This was diagnosed as erythema multiforme. Again, this is also first time I came to know when I read the case, right? The main, what you can call diagnostic feature is this bullseye lesions. Multiple, circle-like lesions will be there, right? So we admitted the patient. We started with Patolocatronadi Kasha, 15 ml 4 times a day after food. Dushi Vishari, 2 tablets twice daily after food. Krishna Churna, 2 teaspoons with hot water at bedtime. Nalpam Radicella, extra application 3 to 4 times a day. Uh, Truth Leha, 20 grams with hot water at bedtime. ये क्या था? पहले we started with पटोला कतरनी नदी, पूरा नहीं लिखा है इधर शायद. पटोला कतरनी नदी पहले खाली पेट में दिए, सुबह, शाम, दोपहर में, शाम को, ऐसे 2 बार, 3 बार खाली पेट में, एक बार खाना खाने के बाद. Dushi Vishari 3 times. With that, he was not having loose motions, right? He was not getting loose motions. Then, along with these two, we added Churna 2 teaspoons at bedtime. उससे भी कुछ नहीं हुआ. So then we replaced Churna by truth layer, 20 gram truth layer at bedtime. Then he started having little bit loose motions. So then he, on third day, he complained of fever and increased burning sensation. So we replaced Dushi Vishari by Bilwa Degada. And burning sensation से जो burning होता था उसके लिए we gave him Kumari Swarsalita twice daily, right? Then this was in between where you can see he had this, you know, this is nothing but, you'll see later, I will show you. Lesions are reducing in severity. This is after 10 days. You can see the lesions are reducing, but can you see his face here? How painful expression is there? Means the lesions have reduced, but pain is still there. Pain, suffering is still there, right? So you can see this presence. Actually, on first day, he did not show this one. He did not show this part, right? He was not, he was not, willing to show that part for, or even not shown, not took photographs also. So at the time of first day, first time discharge, 19 days के बाद में हमने discharge किया उसको. This was the condition, right? This was the condition. You can see here still right axilla में swelling है, left axilla में भी थोड़ा है. Other lesions have markedly reduced. 19th day. So what was given? Limbazication 15 ml thrice daily after food with warm water. Dushi Vishari 2 tablets twice daily after food with honey. Nalpam rice was given for external application, and apathy is non-veg and smoking. We asked the patient to avoid non-veg food and smoking. Right after 10 days, 19 days first treatment plus 10 days gap, came with severe pain and pus in right axilla, right and left side since 3 days. He smoked 5 to 6 cigarettes per day for about 8 days and had mutton once. Very importantly, the other body parts have no new skin lesions except scars. You can see now all other parts have become very clear. Only scars are there. Now you can see this. This has opened. This is nothing but Aksha, hidradenitis suppurativa. This was one of the most, what can call, complicated type of condition. Eczema multiforme with hidradenitis suppurativa. Patient had hidradenitis suppurativa. You can actually video was there. I think this video is not there. Okay. Actually, hidradenitis suppurativa are, this will be like Walmika only. Aksha means multiple, what you can call, pedicles will be there. They are interconnected. Internally they are connected. If press here, it will ooze from here. If you press here, it will ooze from here, like that, right? All sweat bearing glands will be inflamed. So 19 days, ये तो other, on the day of second visit, you can see other lesions were markedly reduced. Now you can see the area, glans area. This was also affected severely. He did not show that on the first day of the visit. Even while discharge also he did not show. When it was reduced, at that time he showed this one. So at this time we were planning for Virechana, but somehow it was difficult for us. Arigvardhani, 2 TID, it would be in between food. Prifachurna 2 teaspoon at bedtime with hot water, Nalpam Retele application. And axilla were washed with Tripla Kashaya and followed by oil was applied, Nalpam. This is the first 19 days IPV treatment, 10 days OPD follow-up medicine, and 8 days. So this is the outcome. You can see the hidradenitis suppurativa is also clear. Now, somehow convinced, his appetite became good. So we planned for Virechan. So here we gave Integrata for Nepana. 40, we started with 40 and 150 ml it ended. So Abhyang with Nalcombrated and the Kaisaka Prakasha was done for 4 days, and fourth day the Virechan was done. Virechan was given with fruit layer 50 gram for motor, and patient had 6 weeks. With 50 gram also he had 6 weeks. So on fifth day again we gave fruit layer 20 grams with 200 ml Prakasha. Patient had 5 weeks. I felt for his age and the condition, 11 Vegas are enough, so we discharge the patient. Right? Discharge medicines were now clear the Hara Chikitsa is given mostly. As Kriti is nothing but Pasanadi Kashai and Mandaloha. So 15 ml thrice daily after food, Ushi Vishari 1 TID thrice daily after food, Nalcomer for explication, Avipati Churna was given, not Avipati Kara, Avipati. SOS, whenever he feels like bowel is not clear at that time, we ask him to take. Right? This is the at that time after Virechana when we discharge the patient, I think at that time, 20 days. Right? No other reasons at all. After this, I think he has not come for any follow-ups. So, Karyat Karananumana. Now we saw Karana we knew, so we assessed the Karya. कारण पता था जेल एलर्जी था उधर ड्रग एलर्जी था इधर भी ड्रग एलर्जी मतलब कारण पता है सो हम कार्य को ट्रीट करते हैं समटाइम्स कारण may not be known. So there, by seeing Karya, we need to assess. So clinical pattern is known, etiology is unknown. So here also we'll see three cases: acute, subacute, and chronic. Right? Food allergy, uh, erythema nodosum leprosum, and Aries disease. Right? We see them. Now itching, a complaint of itching all over the body with erythematous circular lesion, with scaly skin since 1 day. He had food and daba, and same night he started developing feeling of itching all over the body, and next day, present whatever lesions were there, they were changed. And he was not the single person. I think some 5, 6 people, students. He's one of our students. They all went for food outside, right? This was the presentation. You can see erythematous lesions all over the body with severe itching. Right? Now, what is the cause? What is the cause? We call it as food allergy, right? So, if the culprit is food, if the culprit is food, then all those 5, 6 members, others who had the same food with him, all should have developed. तो खाना तो नहीं है इसको अकेले क्यों हुआ now definition of दूषी विषय we have to use there in that first कारणात कार्यानुमान there we have to go with that definition of what is that जीर्णम विषग्न औषधिभिरतम वा means low potent poison exposure. The second one, this type of when we have clinical pattern to assess the etiology, we have to go with Dushitam Desha Kalana Diva Supne Rebiksha Asma Dushete Datun Dasma Dushisham Sutam. But he said, when a person gets exposed to, it is not Dushta. Huh? Many books, in many books, it is like Dushitam Desha Kalana. There many books, translation is given that when person get exposed to Dushta Anna, Dushta Desha. No, it is not. Please, not anything like not telling about anybody, but many books it is written like that. It's not like that. If Anna is Dusta, everyone will affect. Desha is Dusta, everyone will affect. Right? Desha, Kala, if they are Dusta, then they will become Janapad Donsani Rogas. In Janapad Donsani, it is said. यहाँ पे Dusta is not there. Dushitam gets vitiated by change in ahara. Dushitam, Desha, Kala, Anna like that. Diva, Sapne, Rabishnisha. Whenever there is change, at that time, it is getting dushita. What is getting dushita? The visha that is stored in the body, dushi visha. Then it gets dushita. Dushita matlab it is getting potentiated. Then it does dhatu dushan. That is why it is called as dushi visha. First it gets dushti and then does dushan. So now what happened? The patient got exposed to different food and then he developed this. Means patient is having dushi visha in his body and that was triggered by this food. Right? So this is how karya karna we have to do. Right? So again, same. You will not find any different. I told you, no, you will not get new things, but approach understanding will be refined. So same Patola Katran. Actually, Patola Muladi will be best for this, but he was of water dominant property, so I did not give. Dominant Prakriti people will have severe pain abdomen for Patala Muladi. So Patala Karanadi Kasha 15 ml thrice daily, 1 hour before food with warm water. Tushi Vishari 2 tablets thrice daily after food with warm honey. And coconut oil was given for extra application. During treatment on third day, less itching and no redness. You can see redness is reduced and itching is absent. Sixth day, all complaints have completely reduced, no fresh complaints at all. Single prescription, all the complaints have reduced because we are considering the heat. Now, there is one more condition. This is also I came to know once I consulted the patient. Okay? Patient came to me. Erythema nodosum leprosum. Boils on and around left ankle, oozing, burning sensation, pain and slight swelling since 7 to 8 months. Associated with loss of sensation and dorsum of same foot along with the first three toes since 8 months. This was the presentation on day one. The patient came to my clinic at that time. Then patient was asked to get admitted into our hospital. Now you can see he had these lesions on left leg. These are left leg. So this part, and these first three toes, there was no sensation at all. This part and these three toes, there was no sensation at all. Loss of sensation was there, right? And this were for last 7 8 months. These lesions, what you are seeing medial on the medial aspect of the right leg, he developed these in a span of 8 9 days, 7 8 days, right? So he was diagnosed with eczema nodosum leprosum, and he was given standard what do you call leprosy protocol, Dapsone, rifampicin, clofazimine, and one extra application was also given. We had no data about that, right? After 1 month, there was no relief, but patient was asked to continue with same medicine. So patient continued medicine for 6.5 months, and there was no relief. He stopped, and then somebody asked him to visit our hospital, or he came to my clinic, right? Now, in this, what was more of my importance was the lesions on the right leg, medial aspect of the right leg. I asked about this, right? I asked about this. So he has developed this in 7 8 days. What he used to do, he used to keep a big pillow between the both the legs. There is a tendency in village that if something is there, skin कुछ तो हुआ है तो वो दूसरे पार्ट को टच नहीं कराना चाहिए. हो गया तो उधर भी होता है. ऐसा दिमाग में होगा ना. So because of that, he used to keep a big pillow, load something in between. So one day accidentally, that slipped and his left leg came in contact with the right leg. And in span of 6 7 days, he developed 7 8 or 6 7 days. He developed this one. Now, by the contact of this, he developed this. So, this gave me, made me to think about this. Kledena yaspusyatyangam tatrapi kurite runam. What we are seeing? We are seeing the swabhava of the clinker presentation. We have lakshanas. We don't know cause. How the lakshanas are behaving, based on that, we are assessing the condition. Hetu we are diagnosing, right? So what it is doing, the secretions of this part, when they come in contact with this part, healthy skin, there he developed new lesions. So what happened? Kledena yat sprushati angam tatrapi kurite vrinam. It is the last line of Samanya Lutavisha Lakshana. So my diagnosis was Lutavisha because he is a farmer, higher, and then he's उसका खेत just below the क्या बोलते हैं पहाड़ के पीछे ही है, नीचे ही है. बारिश ज्यादा होता है और वो दे कल्टिवेट राइस. सो उनके खेत में पानी जमा ज्यादा होता है ना, वो पानी जमा करके रखते हैं. सो I thought maybe the dead spiders or any insects might have come in contact, and because of that he has developed. But whether it has happened actually or not, but it holds good with the concept of Luthor's. Tatrapi Kurutavinu. So let erythemanodism leprosum be the modern diagnosis. For me, I consider it as Luthavisha, and we treated it like Luthavisha. You can see Pitta Kapha presentation. So Patala Katronadi, 3 teaspoon means 15 ml QID, 3 times before food, 1 hour before food, 1 time after food. Dashang, like 3 times matlab morning before food, afternoon before 1 hour before lunch, and evening around 5 o'clock or 4:35 on empty stomach, and night after food. This is how 3 before food, 1 after food. Dashang Agada along with Kashaya. Whenever this Kashaya was given at that time, Dashang Agada in market it is available as Gulika. 1 tablet was given along with Kashaya. Tripla Kashaya was given for washing twice daily. Parentali Taila is explained in the context of Mandali Sarpa. That was given for extra application. This was on day 1, and I asked him to get admitted. And day 5th, on 5th day, he came and admitted. So complaints reduced to some extent. No fresh complaint. Burning sensation and reduced sensation were persisting with edema. Same medicine was continued. On seventh day, no fresh complaints, edema reduced, but burning sensation and reduced sensation persisted. Eighth day, pain on the asam of affected foot. See, this was a complaint which I got at the night. Night duty doctor gave me, so called me that patient is complaining that he is having lots of pain on the dorsum of left foot. Actually, it was a negative sign for them, but for us, it was a positive sign because that is the area where he had no sensation at all. So थोड़ा क्या बोलते हैं प्लासिबो इफेक्ट के लिए मैंने उसको बोला मतलब ड्यूटी डॉक्टर को बोला जो भी टैबलेट्स है वो दे दो ये पेन किलर है बोलते सो आई थिंक योगराज गुगड़ू वाज देयर इन द वार्ड so they gave him Yogaraj Gugulu. He said, next day when I came, at that time I convinced him, and then severity is reduced. So we replaced Dashang Agada by Dushi Ushari. One QID Dashang के जगह पे Dushi Ushari 2 QID दिया Patol Katranate was continued. 10th day, all complaints markedly reduced, but complained of burning sensation, burning type of pain on and around affected area along with the outcome of affected foot. See, is developing sensation. So again, medicine was revised. Burning है तो दशांग अगर की टाइप चिकित्सा ही परसिस्ट करना चाहिए बोल के अगेन आई स्विच इट बैक टू दशांग बट डोज कम कर दी तो दूसरी विषारी की जगह पे दशांग दिए 1 BD चंदन आसवा है बोल के और चंदन लेप भी दिए ट्वाइस एंड जब भी लेप निकालेंगे तब पारंतरी तैलॉजियम फॉर एक्सप्लिकेशन so on 14th day all complaints reduced tingling sensation over big toe second toe of the affected foot were present patient was discharged this is on the day 14. A patient diagnosed with erythema nodosum leprosum taking standard leprosy protocol for 7 to 8 months was brought to this condition in span of 14 days by simple medicine. Simple medicine means that too patologically Chandanaswa, the Shangagada, the Shivshari. These four internally and what was that? Tripla and what is that? Parenteral thing, right? So at this time, patient was discharged and while discharged, I gave him Chandan Aswa, which was given 400 ml का bottle रहता है. So we continued and दूसरी विषारी दशांक को बंद करके दूसरी विषारी दिए. Parantari Thaila was available, so we asked him to continue that and asked him to come on after 10 days. मतलब on 27th, all patient came. This is on 25th day. He has gained the sensation perfectly all right in 25 days treatment. No fresh complaints, going to work since 4 days. No complaints concerned with reduced sensation. General condition was improved. So, Avanaparambu sir, Maheshwaran Nambudiri part, he was a traditional Vaidya. He was one of the important gurus, high gurus. He always used to tell that whenever you have diagnosed a case as Visha, you have treated it successfully, particularly if you are diagnosed with as Jangam Visha, if you have treated it successfully. So after completion of the treatment, try to give some medicine for Vojavardhan. Make sure that Vojavardhana Dravya should be suitable for the disease it caused. Like for example, I am giving here, I was supposed to give Grita here, right? Vojavardhana Grita. But that Grita should be Kushtagna because it caused Kushta or skin disease, right? So that is why I gave Tikta Grita. Vojavardhaka, Grita, Tikta का combination की वजह से Kushtagna. So context as well as the Kharya, both are very much suitable. So Tikta Grita 2 teaspoon, morning on empty stomach. 2 teaspoon मतलब 15 to 18 ml आता है उतना खाली पेट में. Once daily with hot water. Aryagavardhan was asked to take 1 tablet twice daily between 4 days. Right? After that, there are no follow-ups. This is the last case. I will take 5 more minutes. Uh, 1 hour is there. So another 2-3 minutes I will take. Right? This is the case of Darius disease. In short, I will explain this one. This is a condition considered as a kind of genetically modified disease. In this, what happens now? The solar exposed parts gets hyperkeratinized. All whenever the patient, if patient comes in contact with the matlab, so gets exposed to sun, the parts exposed develop hyperkeratinization. You can see he was from जगह ही पता नहीं महाराष्ट्र का कोई तो है सतारा उधर कहीं तो है ठीक मीरज सतारा ऐसा कुछ है. So this was the condition. He was diagnosed as Darius disease. It was not my diagnosis. It was diagnosed in 2013 when he was 17. मतलब 4 years तक था शायद जब मेरे पास आया. It was diagnosed as Darius disease. Now what will be the diagnosis? Our diagnosis should be Kushisha, right? Because solar exposure is causing clinical manifestations, right? So, in one of my any of I think previous presentations I have told, modern pharmacopoeia, मतलब pharmacology, there is some concept of reactivation of stored poisons, mostly explained for heavy metals and all. So what it says, when we get exposed to different types of exogenous factors, including food, environment, medicines, and all, so those exposures make our body, as per them, make our body to secrete some solvents. When those solvents, if they are suitable for those stored poisons, they dissolve those stored poisons, and bring them to the circulation. So as long as they remain in circulation, the patients develop pathological manifestations, clinical presentation. Once the exposure is reduced, so solvent quantity is reduced, gradually the pathology will reduce. Again, they become dominant. Okay? This is same as explained in Dushyusha. दूषितम देश कालान्न दीवा स्वप्न रिपीटेडली बार बार एक्सपोज हो गया तो एग्रीवेट हो गया क्लिनिकल मैनिफेस्टेशन आ गया एक्सपोजर इज reduced so complaints reduced. So solar exposure clinical hypercatenation, no solar exposure reducing, right? That is all. So it took a lot of time to convince him. Like it was very difficult to counsel करके convince करके admit किए. We did Virechana first visit only. Kalyan Kagrata because Vatakafa Kushtagna and he stress was also there. So like that, Karavishara. Kalyan Kagrata Snepana, Abhyanga with Elatel was given. With Ruth Leha, 200 ml Daksha के साथ Virechan दिए. I think patient had 14 or 15 times loose motion. Sorry, Virechan areas, not loose motion. So after that, we gave Shamana, Patola Katrinadi, empty stomach, Gudichadi after food, Dushi Ushari, twice daily after food. Elaj Tela was given for एक्सटर्नल एप्लीकेशन फर्स्ट टर्म में सेकेंड विजिट में वो नहीं आया उसके पेरेंट्स आए थे पटोला कटोरी आदि कंटिन्यूड दुशीचारी कंटिन्यूड एलादी कंटिन्यूड ओनली गुडिचारी वाज रिप्लेस्ड बाय महामंजिस्तारी काना राइट सो थर्ड विजिट में we stopped all lesions got reduced so we switched back to samana sneha kalyan kagrata sari daso dushi shari externally before bath eladi tela after bath like manjistari tela was used. So this is after 8 months treatment. Now you can see scars are there. Right? Scars are still there. They take more time. But most importantly, the roughness has reduced and he can go under sun now. तो धूप में घूम सकता है कुछ नहीं हो रहा उसको नो न्यू लीजन्स राइट नो न्यू लीजन्स यू कैन सी palmar regions dorsal area and हाथ के dorsal area में you can see they were very much reduced. Actually he sent me एक या 1.5 साल के बाद में आई आस्क्ड हिम टू सेंड व्हाट्सएप में मैंने पूछा था उसको फोटो भी भेजा था वेरी गुड मतलब कंप्लीटली रिकॉर्ड था धूप में जाता है वगैरह कुछ भी वापस न्यू लीजन्स नहीं है बट समहाउ आई लॉस्ट दोज फोटोज सो दिस वाज द आउटकम सो हाउ these other principles are applied here the same Prativisha means Vishad Prayoga which is we are not using here. Prashamana is Doshagna Prayoga from Kaya Chikitsa. Aushadha is Agada Prayoga from Agada Tantra principles. Right? So Acharya Charaka says, Vishad Mumushur Matiman Atha Swaguna Sampadihi Param Prayatnam Matishte Pranada Shad Yatan Rinam. So you have attended thousands of patients. We are treating hundreds of patients every day. But Vaidya should always be ready to learn, update, upgrade knowledge and skills. Because what he says, Mumurshu sometimes because of change in the healthcare sector, changes in the ecology, changes in clinical presentation, diagnosis may get confused. In diagnosis, we may get confused. Mumurshu get confused. So that is why we should be always updating our knowledge and skills, right? So if you want to update your further knowledge and skills in dermatology, I'm conducting a 3 days live program. It will be 25th, 26th, 27th. शाम को रहता है 7 से 9 बजे तक. Today is the last date for registration. And the recordings also will be there, available for 15 days. Right? You can, if you want, you can join. You can text me. I will share the details. So just to conclude, Ananta Shastram Bahulakshya Vidya Alpashya Kalo Bahuvignata Cha Yat Sarabhutam Tadupasaniyam Hamso Yata Kshiram Iva Ambumadya. This is from Chanakya Niti. What it says, Shastra is Ananta. Our skills are innumerable. Time is less. In that less time also, we face lots of hurdles. family issue हो सकते हैं, institutional, personal, health issues, so many things, right? Obstructions will be there. So that is why yat sarabhutam tad upasana. What is essence for us? This essence is not same for all. Like for example, out of Agat Tantra, practicing dermatology is essence for me. So that is why I'm doing. If somebody is feeling that out of Agat Tantra, practicing hepatobiliary disorders or alcohol-induced liver disorders, then that will become essence for that person, right? So if out of Agat Tantra, if for somebody management of occupational diseases, particularly the industrial chemical exposure diseases, so that will become SARA for that person because the SARA is decided by the individual's perception, interest, capacity, and all. Because that is why Hamsa example is given. Because Hamsa or Swan is having the capacity to take milk out of water. That is its capacity, right? Like that. So, Sara depends on essence and need and necessity, right? So, thank you so much for your patient listening. And I'm sorry for taking extra little time. Okay. Thank you.
Thank you, sir. Hello. Sir, am I audible?
Yes, ma'am. Yes, ma'am. Thank you.
Yes, yes, sir. Now, the session is open for discussion. If anyone has any queries, you can kindly raise your queries. Has anyone has any
Sir,
question?
sir, good afternoon.
Sir, Dr.
Good
Saurabh has some
afternoon.
question.
Sir,
Yes, sir.
I'm Saurabh Parashar from Kolkata, practicing. Sir, you mentioned that we have only 4 or 5 of the few drugs which we can use for Agada, for Visha, right? Like Dushi Vishari.
Yes, yes.
Sir, can you please repeat the names of those? And is
No,
there
these
any?
are the agadas which are available in market. That is what I'm telling.
Okay,
There
okay,
is again that it is like half full, half empty. There is scope for even manufacturing non-available agadas and bringing them into market also. Sometimes people ask me, you always keep telling about only those 3 or 4 agadas. So I'm good with that. I will practice that. If you want, like there is scope for that also. If you want to fill the gap, then you can bring new agadas into the market and that. Now market available are Rishi Vishari, Dashanga, Bilwadi and Murwadi Agada. And Panchashiri Agada, single drug is there, Panchanga of Shirishas. So that can be prepared also. These are the only few agadas available in market. But there are some pharmacies, if we give order in bulk, they manufacture and give us. Like Murwadi is not everywhere available, but we get it manufactured by some pharmacies in Kerala. Oh.
If any query is there, kindly raise the questions.
I think somebody wrote a query in the comment.
So there is a question. Kindly
Yes.
tell them how to use the Dushi Vishari Agada and Bilwadi Agada as the students are attending. In what all conditions?
Like, uh, you know, let us take three. Sashanga, Bilwadi, Dushishwar. I place them like that. Consider there is some infection, inflammation is there. So, Tikshnata. Tikshnata matlab fast acting. What you can call Tikshna Beshaja. So, Dashanga will be more potent. You might have seen in that case where everyone nodudam was there. It was very severe manifestation. We started with Dashanga, right? Tikshna Beshaja was needed. Tikshna matlab not in terms of like Khatu, Rasa and all. No. Tikshna means fast acting. We needed that, so we gave Dashanga, right? Once the complaints reduced, we moved to Vishagna, but which is Saumya in nature. For example, we went with Dushivchar. It doesn't mean that Dushivchar is low potent. No. Because if you read the Stavara Vishwavegan for Chikitsa, there, wherever Agada is mentioned, there Acharya has explained Dushivchar Agada. Means Dushivchar Agada is effective in acute poisoning also. बट सौम्यता के हिसाब से, फास्ट एक्टिंग के हिसाब से, इन इन्फ्लामेशन एंड ऑल, देयर दशांगगदा, बिल्वादिगदा एंड दूषिविषारगदा comes. Second is specification also. For example, dashangagada is specific in all types of Kita Visha disease, right? Sarva Kita Visham there. If the cause is Kita Visha, then first choice of drug should be dashangagada, right? Because cause. Next is there are some agadas which are having general indications like dashangagad nahi hai हमारे पास बिलवा का देगा भी कर सकते हैं कीटेशन बिकॉज कीटेशन इज आल्सो पार्ट ऑफ इंडिकेशन ऑफ दशांग बिलवा देगा राइट दशांगगद exclusive for Kita, Bilwadi Kita, Jara, right? Sarpa Visha is also there, Suchika Ajirna are there, Jara Visha is also there. So that is wide approach is there. Dushi Visha is completely different. Dushi Visha can be used in any, whether it is Tavara Visha, Jangam Visha, or Kritrim Visha, or even insect bite, anything. But the thing is, it should be having that nature, like low potent poison, delayed manifestation, repeated manifestation. In such conditions, we need Dashangagada type. मतलब एक बार आके मतलब अंदर जाके क्लीन करके आने वाला नहीं चाहिए जो बार बार होने वाला है उसको परसिस्टेंट होके रिपेयर करके आए एंड वन मोर प्रिंसिपल इज दशांग गदा दूसरी विषारगदास आर नॉट यूज्ड फॉर लॉन्गर टाइम इवन बिकॉज वी डोंट गेट रेफरेंस फॉर दैट बट दूसरी विषारगदा व्हाट इज सेड शील एट इज आल्सो देयर शीलन मतलब समथिंग इट्स कॉल्ड एज कंडक्ट हाँ शील इज कंडक्ट इज नॉट व्हाट हाउ वी बिहेव ऑन वन डे और 2 day or a week conduct is something how we behave throughout the life like conduct certificate and all we get in college so 10 साल कॉलेज में हमने क्या किया उसको शील बोलते हैं शील मतलब कंडक्ट राइट सो दूसरी विषय रहेगा इज सेड टू बी शीलयेत मतलब it is used in conditions where we feel we have to give विषय औषधि for long time then we have to go for दूसरी विषय I think in allergic manifestations you can go with दूसरी विषय in such conditions you can use दूसरी विषय
Thank you, sir.
high IgE more than 200 condition like urticaria, photodermatitis. What protocol can be followed to reduce? See, this concept of IgE and all, I usually do not believe, and I'm not against, but I never, I should not, I usually do not refer any of my patients for any lab investigations. बिल्कुल नहीं करता इवन उसके ऊपर कंप्लेंट भी होते हैं कि आप लोग इवन माइनर एलर्जी टेस्ट भी नहीं कराते केईसी टेस्ट भी नहीं कराते द प्रॉब्लम इज दे आर नॉट गोइंग टू चेंज अवर ट्रीटमेंट अप्रोच अभी समझो यही सी 1000 आया 2000 आया तो भी हम दूसरे विषारी या विरेचक द्रव्य देने वाले उसके साथ में वो 10 आया इचिंग है अभी यही सी इज नॉट गोइंग टू डिटरमाइन आवर ट्रीटमेंट सो दैट इज वन आईजी इज ओके इट इज गुड assessing for the purpose of documentation scientific validation उसके लिए correct but it's not going to determine so what treatment we are going to determine give is determined by the severity of the clinical presentation urticaria के लिए है how often the person is developing urticaria in a day in a week like that so that we have to consider what is the severity of the urticaria is it causing swelling of the lips eyes angioedema and all is taking place that is going to determine the treatment of this, right so generally my approach in urticaria is I start with nitya variation not like regular variation snake on all variation nitya variation best medicine that I always use is होटल मुलारी कषाय उसके साथ में दूसरी विषारी बहुत सीवियर है तो दूसरी विषारी 3 टाइम देते हैं होटल मुलारी 2 बार बोलते हैं बट यूजुअली आई गिव माय नंबर एंड आस्क द पेशेंट टू कॉल इन द इवनिंग सुबह लिए शाम तक 3 या 4 बार फुल वाटर लूज मोशन हो गया तो शाम को नहीं लेंगे राइट एंड ड्यूरिंग दिस टाइम व्हेन द पेशेंट इज टेकिंग होटल मुलारी एट दैट टाइम वी आस्क द पेशेंट टू टेक सीरगतान लाइक दैट मतलब माइल्ड फूड तो ऐसे करने के बाद में क्रॉनिक है तो when complaints reduce then what do? We give शमनस्नि मॉर्निंग तिक्तग्रता ऐसे देते जाते हैं दूसरी साइड देते हैं हफ्ते में 1 या 2 दिन we give विरेचक द्रव्य like अविपति चूर्ण right on Saturday and Sunday or only on Sunday we give अविपति चूर्ण so that it 5-6 बार lose motion ऐसे at least for a month or so you have to do in chronic cases and after that there will be no recurrence you can even challenge the patient you can ask the patient to go and eat the one which was aggravating, which was causing urticaria and all previously. 100% we get results. But sometimes potolicatral may not be suitable for many patients because that causes severe pain, abdomen. So at that time, you can directly replace that with Avipati Churna. Not Avipati Kara, Avipati, the family reference where it is said Sarva Vishahara or something. It is said to be Vishagam. Right? इसमें लवंग नहीं मेन इज दैट that can be used. Erythema and Rare scientific one case. Why did you give 10 days treatment and 10 days gap? No, no, it's not 10 days treatment, 10 days gap. 10 days in-house treatment, 10 days वो वाला. हाँ okay okay हाँ now I understand. प्रिवेंशन ऑफ रिकरेंस के लिए राइट. सो हमने 10 दिन पटोला मुलाजी दे रहे थे ना. हाँ हाँ क्वेश्चन नाउ आई अंडरस्टूड. सो पटोला मुलाजी इज अति वातकर. पटोला मुलाजी वात कर रहे हैं बहुत सिवियर पेन एब्डोमेन करके वात वृद्धि होता है. पेन एब्डोमेन हो रहा है मतलब पक्वाशयगत वात प्रकोप हो ही रहा है इसलिए पेन हो रहा है. वातादृति नास्ति रुजा. सो उस वात प्रकोप को कंट्रोल करने के लिए हमें गैप देना चाहिए राइट. अदरवाइज यू कैन गिव शमनघृत keep giving Patalmule, no problem. But this patient was reluctant to take G. So that is why we gave 10 days gap in between. So that Vata Prakopa should not take place.
Any questions? Sir, for how long Dushi Vishya
Okay, there
Yagata
is
can be
one
given?
question. There is one question. Now you have to understand what I am telling. There is one question. Answer for this I will tell, and you have to answer. समझ लेना चाहिए मैं बोलूंगा. Any role of Agada in post-herpetic neuralgia? Now, just I'll give hint. Um, Keto as per modern medicine, it causes neurotoxicity, cytotoxicity, hematotoxicity, right? Right, it causes. When we give कीट से चिकित्सा, आचार्य says कीट विषज्ञ means कीट से चिकित्सा करता है मतलब whatever is caused by कीट विषा that should be repaired. Then only we can call it as कीट विषय चिकित्सा, right? So if we are giving Dashangarada, it is repairing neurotoxicity, cytotoxicity, and hematotoxicity, right? Right? So in post-herpetic neuralgia, what is happening? Maybe actually 2 days back we were discussing one of with our other department staff. Same thing, post-herpetic neuralgia. क्या हो रहा है? Nerve endings में virus break है, and that is causing the damage in the nerve endings. Right? We use the patients with post-herpetic neuralgia. We treat with चिकित्सा with Grita. तिक्तग्रता या कल्याणग्रता शमनस नहीं देते. Along with that, we give Arigvardhani or something for different person, and sometimes otherwise we give directly the Dashangarada. Dashangarada, you give it for 15 days, 100% patient will recover from post-herpetic neuralgia because नर्व डैमेज को भी ठीक करे. अभी इसके ऊपर ही मैं थोड़ा डिस्कस कर रहा था. नाउ ये नर्व डैमेज मतलब क्या है? डैमेज इन द माइलिन शीथ, राइट? नर्व डैमेज मतलब वही है. सो नाउ होमवर्क करो. एक होमवर्क है सब, एज मैडम वाज टेलिंग स्टूडेंट्स आर देयर. होमवर्क इज कैन वी यूज कीट विषय चिकित्सा इन demyelination conditions? Can we use keto विषय चिकित्सा in demyelination conditions? I'm not asking question. I'm giving homework. Right? Study the pathophysiology of demyelination. Then study nerve injury in keto visha. You will get the answer. Right? I think hope I have answered. How long Dushi Vishari can be given? There is nothing. Time restriction is not there for that. That's why it is said to be Sheela. Sheela मतलब you can give for long time. So the cyanotype it can be given, no problem. There is no issue in that. See, which pharmacy is better in any open seminar and all, it's not right, right? We are the people of Agat Tantra teaching ethics and all. So it will become endorsement. So I should not endorse any company, please, right? It's against the ethics. If you call personally or if you text me personally, I can tell. But like a last meeting, I should not do that.
So there is a question, in which condition
Parenthesis
parenthesis
should be
can be
used
used?
in पित्त dominant. I told you, no, parenthesis indicated in Mandali Visha Vrana. Mandali Visha Vrana में indicated है. मतलब पित्त जो vrana, non-healing ulcers, oozing है, pus है. In such conditions, parenthesis is used for explanation. Right? Okay, I think there are no more questions. Thank you so much for your active participation and giving me the opportunity and listening to my lecture. Thank you. If you want to
Uh,
join our 3 days program, I will share the details with Dr. Ashish and he can share with you, or you can directly contact me. I'll give the details. Thank you. Thank you so much.
okay.
Thank you, sir.
Thank you, sir. Sir,
Thank
on
you,
behalf
madam.
of Vishwa Ayurveda Parishad, I, Dr. Shanti R. Nair, take this opportunity to express our heartfelt gratitude to Professor Dr. Mahesh Savalagimath, sir, for delivering such an insightful and motivating session. Sir, you have beautifully highlighted our scope, our strengths, and emphasizing the areas where we need to focus in accordance with current clinical needs. The way he, sir, integrated the principles of Agada Tantra with Kaya Chikitsa was truly enlightening. Sir clearly explained on the importance of Hetu, dosha assessment in clinical practice, and sir has well explained the clinical cases, which has provided us with valuable guidance for our future practice. This session has not only enhanced our clinical understanding, but will also help us in imparting better knowledge to our students and shaping them into competent clinicians. So words are not enough to express our gratitude, but we sincerely thank you, sir, for your valuable time,
Thank you, madam.
guidance, and inspiration. Thank you, sir.
Thank you, sir.
Thank you, madam. Thank you, Ashish. Thank you, everyone. Namaste.